everyone, I'm Dr. Quick and welcome back to Quick Talks on Skin and Hair, where we will break down big skin and hair topics into quick, practical tips that you can actually use. So today let's talk about how nutrient deficiencies can lead to hair loss. Our hair, skin, and nails are the first place to suffer when we have these nutrient deficiencies because our bodies are super wise and will prioritize these resources towards more vital organs and processes in the body. However, I don't always recommend leaning on a 4-capsule hair, skin, and nails multivitamin supplement to cover your bases for these nutrients because, believe it or not, taking too many unneeded supplements can sometimes overburden both your liver and your wallet. So, in my opinion, the best way to uncover and treat these nutrient deficiencies that are specific to your situation is by testing and not just guessing. So first up, let's talk about iron. Iron deficiency is one of the most common causes of hair thinning, especially in women. Your body needs iron to help carry oxygen to your hair follicles, and when there's not enough, your hair growth cycle slows down and more enters the hair shedding phase. So other symptoms include experiencing easy bruising, fatigue, insomnia, heart palpitations, and heavy menstrual cycles, both a cause and an effect. In addition to a complete blood count and standard iron panel, I run ferritin, which is your iron storage, and this can show iron deficiency before it shows up elsewhere, which is precisely when it might be impacting your hair and not causing these additional symptoms that might prompt you to get this checked out. Next is zinc. Zinc helps with tissue repair and keeps the oil glands around your follicles working properly. Low zinc can lead to weakened hair structure and even shedding, especially if you're recovering from illness or have gut issues that might impact absorption. Another really common one you hear about is biotin. This is in all those combination supplements. Biotin is well known for supporting healthy hair, skin, and nails, but here's the thing. Biotin deficiency is actually pretty rare unless you're dealing with, certain gut conditions or medications or very restricted diets. Also, those high doses of biotin found in combination supplements can actually trigger acne for certain prone individuals. Let's not forget about protein. Hair is literally made of keratin, which is a type of protein. So if you're not getting enough quality protein in your diet, your body will not use it as building blocks for hair growth. So this is one I do usually recommend for all my hair patients. There's so many other benefits to having enough protein, usually in the form of hydrolyzed collagen, which can be added to coffee or water or smoothies. Vitamin D and B12 are also important for supporting healthy hair follicles and circulation to the scalp. Vitamin D deficiency is so common that I'm actually surprised when I see it come back normal in patients' labs. It's another one that you really need to test while supplementing, as it's a fat-soluble vitamin that can build up in the tissue and cause issues if it gets too high. So we definitely want to keep it in that sweet spot. For B12, this can also sometimes trigger breakouts for some, just like biotin. So we want to keep this recommendation individualized to someone that actually has a B12 deficiency. So after all this, what can you do if you're noticing hair loss? I'd say it's essential to first check your nutrient levels. I like to call this the low-hanging fruit of hair loss because it's actually a relatively simple fix. We replenish those nutrients with supplements and work on a plan to ensure that you can eventually maintain those levels through a whole foods diet. So if you'd like to come in and get your labs checked out with me, give Nourish a call to schedule a consult and I can help you get to the root cause. Thanks for watching, and I'll see you next time on Quick Talks on Skin and Hair.